Assalamualaikum. Thank you, Dr. Malik, for inviting me and setting an excellent background for my talk. So I'm going to talk about the preventable neurological disorders. When I first started my residency around 10 to 11 years back, I was warned by many that it will be a depressing, rather non-rewarding field because rarely you will see a patient walking out of the clinic without any disability. So कुछ हद तक शायद मुझे ठीक भी लगा, but now I can say after the practice of so many years that there are many aspects which we can prevent such disabilities, or we can educate the patient, we can manage them before developing the diseases at all. If we talk about the burden of neurological disorders, we count the disabilities, or we count the disorders in terms of DELIs. DELIs are actually disability adjusted life years, and according to DELI count, nervous system disorders are the leading cause of disability worldwide. If we see this colorful chart, this is taken from a study which has been recently published in Lancet Neurology in April 24, and this is showing the global incidence of diseases and the local incidence of diseases. So यहाँ ये जो yellow arrow है, this is showing the global incidence of diseases, और यहाँ पे इन्होंने इसको वो किया हुआ है कि नंबर 1 पे कौन सा है. स्ट्रोक इज एट नंबर 1, neonatal encephalopathy globally initially in number 9 पे थी, now it has come to number 2. Then migraine, dementia and diabetic neuropathy. और अगर हम साउथ ईस्ट एशिया में देखें, ये जो रेड एरो शो कर रहा है, more or less we have similar incidence and prevalence of these diseases. So the global trends in nervous system disorders has shown an increased burden over the years. The stroke is at number 1, accounting for the maximum number of DELIs. Then neonatal encephalopathy, it ranks at 2. Migraine and dementia are also major contributors. If we see the neurological sequel of preterm birth, in the Southeast Asia, it ranks at number 4, but globally they are at 9. So we can see the neonatal or hypoxic encephalopathy or the sequelae of preterm birth, we can prevent it by measures. These are the top 10 preventable neurological disorders. We will talk about them one by one. Okay, in this chart, you can see that the most common risk factor which is causing different neurological diseases are the high systolic blood pressure, and at number 2 we have high fasting plasma glucose level. Both of these are preventable. We can manage the diseases, hypertension and diabetes, and by controlling these risk factors, we can prevent the major disabling cause of neurological disease, that is stroke. You can also see that we have smoking, high alcohol use, ambient particulate matter population. I would like to talk something about this. The particulate matter, we use the term PM 2.5. That is the particulate or the solid matters which is less than 2.5 micrometer in size, which is dissolved in our surrounding air. The solid particles or the liquid droplets, these are major contributing factors for causing strokes and other disorders. Okay, so there is an issue that the guidelines are changing very rapidly. So the target of, what is the target of blood pressure? कितना blood pressure maintain करना होता है students? 120/80 है, और अब वो तो ठीक है, और इसके अलावा और पहले क्या था? पहले 140/80 था और अब वो रिड्यूस हो गया है हमारे पास. Okay, so for stroke, the risk factors, the common risk factors are blood pressure. So what we have to do, we have to give the antihypertensive medications, anticoagulants, antiplatelet, statins. We have to educate for smoking cessation. Air quality, the bad air quality is an important risk factor. We have to control it. So the high systolic blood pressure is 57 cases, 57.3% of major contributor. Then the air pollution, household air pollution. Household air pollution means the pollution which is generated by fuel combustion, जैसे कुछ इलाकों में होते हैं लकड़ियाँ जलाई जाती हैं, or the chemicals we use in our household, and smoking. Okay, so there is a website which tells us about Pakistan or the worldwide air pollution. We can see that Pakistan stands at number 2 among the worst countries which have the air pollution. And how polluted is Pakistan according to the survey in 2023? If you can see here, the PM 2.5 in Pakistan, the figure is 14.7. It is 14.7 times higher, which is the acceptable level as given by the WHO. In 2023, the cleanest city of Pakistan was AKBAR, and the most polluted city was Lahore. और ये मैंने कल ही इसकी वेबसाइट से लिया है. द मोस्ट पोल्यूटेड सिटी अकॉर्डिंग टू कल रात 12 बजे इट वॉज हरीपुर. सुन के थोड़ा अजीब सा लगता है, वो तो काफ़ी अच्छी जगह है. इट्स बट द मोस्ट पोल्यूटेड सिटी इज़ हरीपुर, और कराची इज़ एट नंबर 6 एंड लाहौर एट नंबर 2. ओके, हाउ वी कैन इम्प्रूव द एयर क्वालिटी? देयर आर multiple ways by which we can improve the air quality, because as we see that it's an important contributing factor for stroke and other preventable neurological disorders. So we have to follow the principles of reduce, reuse and recycle. We have to avoid the single-use plastics, opt for reusable products, avoid chemical pesticides, plant trees, use energy-efficient means. For transportation, we can use public transport, carpooling, cycle, and we can opt for fuel-efficient or electric vehicles. We have to educate our community, and we have to involve them in maintaining the better air quality. Okay, after stroke at number 2, we have hypoxic ischemic encephalopathy, which is a major factor in Southeast Asia. Previously, it is known as birth asphyxia. And how it occurs, it is characterized by clinical and laboratory evidence of hypoxia, which occurred at the time of birth. We can prevent neonatal encephalopathy, and it's easy that we can prevent it. There are very doable actions which we can do to prevent this disorder, because hypoxic encephalopathy has a long-term effect and long-term sequelae for that patient, for that child. By regular and effective antenatal, perinatal, and postnatal monitoring, we can identify women with high-risk pregnancies. By fetal heart monitoring, by preventing premature birth, we can give steroids if we are suspecting a premature delivery. Okay, on number 3, we have migraine. Migraine is a very common disorder globally as well as in our setup. And there are multiple factors which we can do, which we can educate our patient to prevent to this disorder, because migraine, although it's not a very serious disorder, but it is causing disability to life. It adds disability to life. So what we can do, we can identify the factors, trigger factors for the patient, which is very specific for one individual to another. And we can improve awareness. We can provide them with early preventive therapies so that migraine can be prevented and quality of life can be improved. Okay, at number 4, we have dementia. We have different type of dementia. Some are neurodegenerative dementia, for example, Alzheimer's, Lewy body dementia, and we have vascular dementia. Vascular dementia can be prevented by controlling the vascular risk factors, by controlling diabetes or hypertension, by maintaining lower BMI, by controlling dyslipidemia and other factors. Apart from these vascular risk factors, there are studies which shows that the persons who have higher mental activity during their life, who have more social interaction, they are usually prevented from developing dementia early in life. So what we have to do, we have to improvise the literacy rate of our country. We have by increasing the complex work, by rich social network, by doing mentally stimulating activity, physical activity, healthy diet. By taking all these measures, we can prevent dementia to some extent. Then diabetic neuropathy. There is no cure for diabetic neuropathy, but we can delay its occurrence. And what we have to do, it's only preventable by maintaining an optimal level of blood sugar. And the targets are between 80 and 130 before meals, and less than the level of random blood sugar less than 180. Okay, now we have epilepsy. There are multiple causes of epilepsy. Some are genetic, some are inherited, some we cannot prevent epilepsy in every case, but there are instances in which epilepsy is a sequel of some preventable conditions. For example, epilepsy can occur as a sequel of neonatal encephalopathy. It can occur as a consequence of meningoencephalitis. It can occur as a result of road traffic accidents or by CNS trauma. So we can prevent these conditions in order to prevent or decrease the burden of epileptic individuals. Okay, I have found a new definition of selfish. So those people who are busy on their cell phone every time, these are actually selfish. Okay, there are neurological sequel of preterm birth. What happened when a baby was born before the due date? There are multiple disorders which a baby can develop later in their life. ज़रूरी नहीं है कि at the time of birth उसको hypoxia ही होगा. If there is no birth asphyxia, still a person can develop these sequelae due to preterm birth. These are cerebral palsy, low IQ, hearing loss, epilepsy, ADHD, and autism. These are becoming very common these days. How can we prevent the sequel of preterm birth? By preventing preterm birth, by taking different measures, and by optimizing maternal healthcare facilities. Okay, so by giving a good antenatal care, by giving an excellent natal care, and by providing a good neonatal care, we can prevent the sequel. Okay, you never know how strong you are until being strong is the only choice you have. And this true holds for different disabilities, for different sequel of different infections. What is this? Opisthotonus. और किस कंडीशन में होता है? टेटनस में. Okay, the most preventable neurological disorders are the infections. There are CNS infections which specifically target nervous system, and there are other infections, systemic infections, which all have their neurological complications. And the best way to prevent these neurological disorders are to vaccinate beforehand. And luckily we have vaccinations available for many infections. We have measles, mumps, rubella, all can lead to meningoencephalitis. We have tetanus, polio can cause disability, rabies, influenza, Japanese encephalitis, yellow fever, pneumococcal disease, meningococcal disease. So basically all of these organisms can cause meningoencephalitis mainly, and it can also affect nerve and muscle as well. So the best way to prevent these infections are to vaccinate. Brain cancer, we have primary brain cancers and secondary brain cancers. Primary brain tumors are, there's no cure to prevent a person from developing a primary brain tumor specifically, but we can minimize or we can prevent a patient from its metastatic or paraneoplastic effects. If we talk about the infections, HIV is becoming more common even in our population, and there are direct effects of HIV on central or peripheral nervous system in forms of AIDS-related dementia, polyneuropathy, myopathy, and there are some treatment-induced disorders. For example, heart therapy can cause myocyte muscle disease. It can cause neuropathy, and there is a wide range of opportunistic infection which a persons with AIDS can develop. Hepatitis C similarly can affect nervous system, peripheral and central nervous system. It can cause neuropathy, different type of neuropathies. CIDP, it has association with CIDP. It can cause mononeuritis multiplex, and also it can cause myelopathy. Then there are multiple sequelae and neurological complications of meningoencephalitis, which we can prevent by early detection and by providing complete therapy. For infection control, luckily we have different vaccinations and immunization programs to prevent these infections. Okay, so the conditions has not been changed since now. मेरे ख्याल से ऐसे ही कुछ हो रहा होता है ना एग्जाम के टाइम पे. Lastly, we have some disorders which are caused by nutritional deficiencies. The most common nutritional deficiencies are related to B complex like B1, B6, B3 and B12. And also we have some deficiencies related to folate or iron. By taking a healthy diet, by supplementing diet or augmenting the diet with these nutrients, we can prevent many neurological disorders. Okay, so the conclusion is that neurological disorders are becoming more common, and it is the most common cause of causing the global burden of disease. Many of these are preventable to some extent, because once the disability sets in, it would be difficult to cure the patient completely from that disability. So a stitch in time saves 9. Okay, I will end my talk with a short ayat, but it has a very deep message. Wala tamnun tastaksiru, and do not confer favor to acquire more. Thank you.